I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So what are you waiting for? Let's do the damn thing. So, during one of my random doom scrolling, I bumped onto this powerful post. Let me show it to you here.
The kids are in town for a funeral, so pack the car and dry your eyes. I know they got plenty of young blood left in them, and plenty nights under pink skies you taught them to enjoy. So clean the house, clear the drawers, mop the floors, stand tall like no one's ever been here before or at all.
I had to know more about Jessie. So let me tell you a little bit about her before she comes onto the show. Jessi Dressler is a highly experienced and registered OB-GYN sonographer with a deep commitment to patient advocacy and compassionate care. For years, Jessie honed her skills in high-stake environments, working extensively in hospitals and emergency rooms where she performed a wide variety of critical scans. The clinical background, equipped with her invaluable experience, also fueled her passion to address a common gap in healthcare system, the need for emotional support and personalized care for expectant mothers. As a busy mother herself, Jessie recognized how important these fleeting moments of seeing your baby on an ultrasound screen truly are. This realization led her to found New Life Imaging Ultrasound, a mobile company that specializes in providing high-quality, in-home 3D, 4D ultrasounds across Middle Tennessee and Kentucky. Jessie's practice is also a powerful example of compassionate care as she offers her services free of charge to women who have experienced confirmed pregnancy loss, providing a vital source of comfort and acknowledgement. Jessie's journey from the high-pressure environment of the ER to building a business focused on personalized, emotionally supportive maternal care makes her an expert on the complexities of healthcare delivery and a true advocate for patient experience. So welcome, Jessie, to the Gritty Nurse podcast. I'm so excited that you're here.
Thank you. Thanks for having me.
One of the things that really drew my attention to your posting was the fact that as a nurse myself, we have similar things in common. And I think one of the things I'd probably say is most people don't really understand what I do as a nurse. I think there's these ideas where people are like, okay, this is how this is operated, or this is how, a nurse runs her day. And we usually aren't the ones that get to tell our stories. And I'm sure it's probably the same for you as a sonographer. But maybe even before we get started, could you tell us a little bit about yourself, your background, and did sonography choose you or did you choose sonography?
Yeah, those are great questions. I'm Jessie. I've been an ultrasound tech for 3.5 years. Um, I had some health issues in my early 20s and was getting ultrasounds every 6 months and just fell in love with the diagnostic side of it and the patient care. I get a little woozy and queasy around wounds and things. And so I knew the nursing was not for me.
Fair.
Yeah, exactly. But I still wanted to be involved and still wanted to have my hands on it. And so I really started thinking about and praying about what I wanted to do. And ultrasound just was it. It just felt right. And so I joined. I had two young kids at the time and ended up getting pregnant in ultrasound school. It's a story for another time. But I ended up super busy and yeah, it was crazy. But I graduated and got my OB-GYN registry. And then now I work in a hospital setting. And then also I have my own mobile ultrasound business that I do as well. So I'm
Yeah,
busy.
no, yeah, I was gonna say that's pretty innovative. I think in Canada we don't really have anything like that here. Most people have to go to a clinic. I think maybe we have, yeah, I guess we would probably have privatized versions of that, but like I haven't heard
Yeah.
of very many different options that there are. But again, I think it's such an innovative way to kind of reach other women, right? I think sometimes it's hard for us to leave. I remember, having to leave and trudge out. I don't know how much snow you get where you are, but having to go out for those ultrasounds. And then again, for me, I got really sick, so I had to have frequent ultrasounds, and it was getting harder and harder to get out. So I could imagine how, going to someone's home, how much more intimate and how much more accessible that is as well.
Yeah.
So I wanted to talk a little bit about one of your posts. So I saw your post, it came across my For You page, and I couldn't help but notice the authenticity in it. Why did you feel it was important to let people know what sonographers go through on a daily basis?
Yeah, that's a great question. So, in sonography, and I'm going to talk specifically on the ER and hospital side of it, we see a lot of traumatic things and we aren't allowed to speak. I mean, we can make small talk, but a lot of people don't know we're not allowed to share our findings or anything. We leave that to the radiologists as it should be. And so we see a lot of trauma and a lot of really difficult things. And I think a lot of people forget that once you walk out those doors, like, there's still like nurses and doctors, like we're still people and we still hopefully have empathy for our patients. And so I know for me, especially with pregnancy loss, that's like a personal, I did lose a pregnancy. And so I
Sorry.
really can have, thank you, I really can have empathy for that. And so, well, we're not allowed to tell the patients, when there's a problem, we still hold on to it. And I still have such a heart for the women who are going through it and the families. And so I
Yeah.
just wanted to show, especially after a hard scan, that's when I decided to post the video, was there was something really awful. And I just wanted people to see the raw emotion of what that was like.
Yeah, no, I think that vulnerability is so important, right? I think that those are the social media posts for me that actually mean the most, right? Because like you said, you never know who your patients are, what they're going through at the end of the day. You might do a scan, you're still a human being at the end of the day, but I truly appreciate seeing that cuz like you mentioned you had a loss and I'm so sorry that you experienced that. It's also a story that I could share that I had a loss as well, and it was so impactful for my sonographer didn't say a word, mind
Yeah.
you, and but I think that as women we just have this kind of intuition that we know something's already wrong. And she had come in, she had done my scan, and she was very quiet, and she was very respectful, but just I just knew like something was wrong, and she kind of put her hand on my shoulder and she's like,
Mm.
okay, like you do need to go up. I think like yeah, I had to be scanned that morning, and then I had to go see my OB anyways. She's like, okay, you make your way up to your obstetrician's office. But I knew, but at least just that gentle touch was what meant so much to me, right? And I think that we forget about all of the other team members that are a part of the care team, and sonographers are a huge part of it. My background is in labor and delivery. That's where my
Mm.
specialty is. And we actually had sonographers that were on our unit, and we were pretty tight with them because
Oh,
it was so important for us to have that relationship, and we shared so many stories. So it was just so important to see that vulnerability. And I think there's so many women that appreciated that post to be like, how hard it was and how difficult that situation might have been, and showing that you have a human side as well to say that it's hard for me too.
yeah. Yeah. No, I'm so sorry that you've had to go through it as well. It changes you. It really
It
does.
does,
And
yeah.
and I think especially for the sonographers who haven't been through it, I know it's hard to relate to women going through it. And so sometimes I've noticed a lack of empathy, and not out of like them being like inappropriate or anything like that. It's just, it's hard to relate. And so I think it definitely gives me a leg up in having to experience it and then getting, having to see it. And I worked really closely with an OB-GYN at one of the other hospitals I've worked at. And she really loved how thorough and empathetic and all of that I was, because, it means a lot to me, and women's health means so much. And I think it's just important to work together in getting, proper care for women.
Yeah, absolutely. And I think you're doing the work, right? It's important that we have people like you in that role that is providing that compassionate care. Let's maybe move to something on a less serious note. I
Yes,
saw a
please.
post. I saw a post. A haunted house, but flirty men during testicular exams. Please explain.
Yes. Oh my gosh. Yes. I do a lot of testicular scans, which not my favorite, but it's so
Right.
necessary. I've seen lots of really rough things. And so I
Mhm.
don't go in thinking, oh, here we go. But once I'm in there, and if you're feeling inappropriate, I think
No.
that maybe we shouldn't speak. And
Right.
so, yes, I did have a patient who was very happy that I was there.
Oh God.
Yes. And I did have to call a nurse in to say, he is being inappropriate. And he said, it's not my fault that you're hot. And I was like,
Whoa.
No, nope, we're done. That's it on the scan. So I did have to end it, and he had to go somewhere else. But it was a bummer. I was not
I
very
am
happy.
so sorry. That is
Yeah,
so inappropriate. You
so
know,
gross.
God, the cringe, right? I think
Hmm.
back to like my nursing days. So again, I moved into a field where predominantly my patient population has all been women,
Bless
maybe
you.
by choice. But I remember actually having one of my clinical it was like it was a clinical rotation. I think it was in long-term care. And they teach us in nursing school. They're like, "Oh, if you're doing your bed bath and the patient has, an erection, you just put a blanket over and say that you're going to come back." It doesn't really work that way because it's just like, what I think the best way is you give them the cloth, you let them do it themselves, but it's just
Yeah,
awkward because when that happens, you're just like, I have to leave. It's
yeah. I can't.
I cannot stay
Yeah,
in this situation. And again, I think about safety, right? Like I'm glad at least that you were safe and felt protected. And I've
yeah,
unfortunately have heard stories where people aren't protected and
yeah.
it turns into an awful situation. But I'm glad, and at the end, you were still protected and was kept safe.
Yes. Yeah,
Another question for you. I'm
yeah,
sure you probably get this question all the time. So you mentioned kind of why you can't tell. Could you maybe give a little bit more why you can't, spill the beans when people are having their ultrasounds? Because I think that's probably maybe the most questions that you get.
yeah, yeah. I get that question
Tell me
almost
what's going
daily.
on.
Yeah, exactly. And I so wish I could. We are trained to know what we're looking at. So let's talk about like a gallbladder. If I go in there and I'm scanning and I see gallstones, like I'll go and put it on my worksheet to the radiologist, like gallstone seen because it's cut and dry.
Right.
But radiologists have more experience. And so they may think that that looks like a gallbladder polyp. And so they're like, it's best that we aren't the ones to say it because we haven't had the years of schooling and stuff that it takes to diagnose. We also don't want the responsibility of it. If we're
Right.
wrong, they can come for our license. And just
Mm,
like doctors, same thing, but we're just not qualified. We had 2 years of schooling, which is a lot, but it's safer for the patient that the sonographers aren't the ones diagnosing you. And so it's such a good question. And I have to explain it all the time because it's like, yes, I do it every day. Yes, I know what I'm looking at anatomy wise, but I am not trained to know every, what's the word, every pathology that there is. So
right.
I
And
always say, go ahead.
no, you're absolutely right. I think that, at the end of the day, it's probably a question you get a lot, but it has to do with our scope of practice. It's just like, this is beyond
Yeah.
my scope and I can't, divulge because I don't want to tell you misinformation, which I think is,
Mm.
perfect explanation. I'm sure there are people that get frustrated with you, but now, like, maybe they listen, they know. It's just like you
Yeah.
can't because of legal reasons as well, right? And
Yeah.
I
Same.
remember wanting to know and just being like, "Hey, what's my baby?" And it's just like, can't tell. I know, we can't tell. But
Yeah.
again, like I think it's important that folks out there have an understanding as to why, so you don't have to get bombarded with the questions. I'm sure you still will get bombarded
Yeah.
with the
Yeah.
questions.
And
But
I totally get it. I totally get it. Because as a sonographer, even I still have to get scans. And I'm like, hey, I'm a sonographer. You want to and they're like, no.
screen.
And I was like, okay, yeah.
Yeah. So one of the things, again, pregnant moms, I've seen this all the time. Buying ultrasounds. What's your take on buying an ultrasound machine?
Yeah, I don't like it.
Okay.
Yeah.
Fair.
Yeah. I mean, I do, let's say, like, let's go to my business real quick. I
Right.
do their elective, non diagnostic. I'm working on actually getting certified to be diagnostic for the business, but as of right now, it's non diagnostic. And let's say I have a client, not a patient, and I see something wrong with the baby. I have to now call the doctor and I can now get things moving along. But let's
Mm,
say you're scanning yourself, you see a heartbeat, but that's maybe the only thing you know to look for. But
right.
there's a whole other issue, but you're like, I saw a heartbeat. I don't need to go get my doctor, go to the doctor. Like everything's okay. That's what scares me is like,
Right.
you may see a heartbeat, but that's 1% of the whole picture. And so I'm scared that people scanning themselves, women scanning themselves, are going to assume they're okay because they see a
Right.
heartbeat or they can't find it because they don't know how. And so
Right.
now they're flooding ERs when everything really is okay. And it was best that maybe you didn't try to find it yourself. That's my
Right. No,
take.
I think that's important, and I think people maybe don't even understand that that's probably what the trepidation is. It's not that we're trying to say to people, "Hey, we don't want you to be informed." It's more about, you know. actually might miss something. And,
Mhm.
there are experts that are trained in this field that can do that for you. And I think I've always said this to my pregnant patients. If they called in and they ever had a concern, my response always to them, I cannot do an assessment over the phone. So just come in and let me see. We could get you checked
Yeah.
out. And I think that's just like the best approach, right? If there's a concern, go get seen. Like I think that's
Yeah.
always the best way to do things.
Yeah, absolutely.
I have to say, you're pretty skilled. Pretty skilled. I did a 3D ultrasound and my babies looked like mud. So
Bud.
is there is there a trick to 3D ultrasounds work? Because I was wondering, is it about drinking more water, or is it more about the skill of the sonographer?
I think it's all of it. I think if you're well hydrated, I always tell my clients a couple weeks ahead, like making sure you're drinking. I mean, obviously, you should be drinking, I say at least, 80 ounces of water when you're pregnant. But if you're doing that at least a couple weeks beforehand, it clears out your amniotic fluid. And so it gives us a clearer window, less fog over baby's face.
Okay,
But a lot of it, I would say 75% is baby positioning. We want
right,
that profile because that gives us the direct hit to the face.
right.
And so it makes it definitely more ideal. Now, there are tricks for sonographers to get babies to kind of try and position that way. I am a self proclaimed baby whisperer. So I do get a lot of my babies to flip for me, but it's definitely a combination of all the things.
Okay, so I was feeling bad. It's probably my fault because I did have a lot of slushies. It was definitely
Slushies.
not water. I don't know. It was like my daughter. I just needed slushies, so I just had
She wanted
slushies
it.
throughout my pregnancy, and
I love it.
pictures were not the clearest. I was quite concerned, but she came out very cute.
I bet she did. I bet she did.
So, what are some of the most memorable moments you have as an ultrasound sonographer?
Ooh, I mean, memorable. I'll say that there was a time that I caught something on a patient that CT did not catch and MRI did not catch. It was a very infected appendicitis.
Wow.
And she had a big abscess on it. And I was the one who went ahead and took the liberty to call the radiologist, tell him my concerns. They trusted me enough to call the OB-GYN. She was pregnant, bless her. They called the OB-GYN and they got her into surgery before any of the results came back. And they came back to me and they said, you potentially saved her from a very septic and very dangerous situation. And so that made me feel really good. That made me feel like what I did mattered.
Well, I mean, I think what you do does matter. I think
Yeah.
I think that's such an amazing catch, right? I think that this is why I always say to people, it's not just nurses and doctors. There's so many people in the care team that contribute such valuable information, whether it's a sonographer, whether it's a social worker, whether it's, that nurse or whomever else that's a part of the team. We all need to be working together to get that full clinical picture. So
Yeah.
never minimize the work that you do because it's hugely important. You mentioned top 10 reasons to get an ultrasound, but maybe list your top 3. What are your top 3 reasons why someone should get an ultrasound?
Yeah. I would say number one is that lower right quadrant pain, tender to the touch, nausea, vomiting, fever, all of that. I've seen some very serious appendicitis that came in just too late, and that's really traumatic, really, really bad. Upper right quadrant pain, cholecystitis, anything that's making you feel that nauseous and that just sick and unwell, go in, definitely go in. And then a positive pregnancy test, haven't seen an OB yet, severe pelvic pain that caused fainting or shoulder pain. And that's typically an ectopic pregnancy. And those can get dangerous really, really, really quick. Those would be my top 3 of like, get yourself in there right now. Don't even question it.
Yeah, and I think those are probably the ones that I think of too. I actually and so this is wild. One of the things that is crazy about me is like as a nurse, I've had all these health issues. And I'm kind of like, oh, you know what? I it must be, and particularly when it comes to women's health, like all obstetrical related, and I'm just like, it's just the worst karma ever. But yeah, like I had an ectopic pregnancy and I had a torsion during my last pregnancy. So I
Oh
have a
my
baby that's
gosh.
18 months, and it was wild because I started feeling pain, and I believe she was around at the time maybe around 14, 15 weeks. And I had this sharp pain in my right side. Just I'm like, I just if I just lay down it'll go away. It did not go away. It almost got worse actually as I laid down. Got to the ED. They did all that stuff. The sonographer came in. She actually had this look on her face like, what? And the one thing they were concerned about was because they're like, well, you're pregnant. What do we do here? And it
Yeah.
was just by like the grace of God, honestly, that the OB team was like, let's consult with surgery to kind of figure out what the next plan was here, because they had to bypass my uterus to fix my torsion,
Yeah.
because they're like, you're pregnant and we have to, otherwise they would just kind of gone in, but they're just like, yeah, well, you're pregnant, we have to bypass your uterus. But it was just, again, the sonographer's work that was just like, hey, like this is the issue. So again, just really grateful to have you, people like you that do the work that you do. In relation to sonography, is there anything that you really want people to know that they don't know about the work that you do?
I mean, I think we kind of talked about it in the beginning, just recognizing us as people too. I feel like every healthcare worker can agree. It is hard for us to be, ignored or whatever. But also for healthcare workers, I'm going to talk specifically to ultrasound, but acknowledging all healthcare, just that these people are in pain. And so I feel like a lot of the time when we're complaining about how patients are treating us, we're not taking into account that, our patients are in a lot of pain, or they're really scared, or, all of those things. And so um just understanding, I feel like in all parts in healthcare and patients, just that, we're all people. We're all just, trying to do the best we can. We're trying to give good care. They're trying to receive good care. And it's tough. So just, I feel like just understanding between everybody.
Yeah, no, I think that's a really good message. I think that, during this time where there's so much, tension around the world, that just a little bit of understanding goes such a long way. And just, being able to have the ability to perspective take, to be like, you know what, I don't know what that person's shoes are like, and I might not know what that person's going through, but just trying to put yourself in that other person's shoes. So I think that's such an important place to land. And I think that, you guys do a lot of great work. And I've actually never had a sonographer on my podcast. So I'm glad
Oh,
you're the first one. You're
I'm
pioneering
honored. Yeah, I
for
love
other
it.
healthcare professionals to come onto the Gritty Nurse. But again, like I
Love
said,
that.
your story really resonated with me, and I think it
Mm.
was so authentic. And you're very funny. I've seen on some of your other posts. I'm like, okay, she's got a funny side too,
I love it.
which I really appreciate as well. So
Thank you.
before we leave, is there anything that we haven't talked about that you'd like to maybe mention?
Yeah, there's one thing that I wanted to, it's from sonographer to nurse. I've had a couple of questions from nurses recently, which is interesting with the being on social media, is all the
Mhm.
different types of people that reach out, which has been so fun for me. But I've had a couple of nurses ask, like, hey, what's something that you as a sonographer would want us nurses to know or understand between the two of us? And I said, one thing that I really would love to just say is to help with communication. I've had nurses get really upset when I've taken a patient back before they've done blood draws and stuff, which I understand. Sometimes I'm in such a hurry, I haven't looked at, the full chart to know what's been drawn and stuff. And so I've had them go directly to supervisors before talking to me. And I'm like, oh my gosh, like
Wow,
I'm so
right?
sorry. It was never my intention to purposefully delay. They said I was delaying patient care. And I was like, I'm really, really sorry. And so just, between sonographers asking like, hey, before I take this patient back, is there anything you need to do? And vice versa. And sometimes with a pelvic ultrasound, they order the urine the same time as the pelvic ultrasound. And it's considered non diagnostic to have an empty bladder for the first portion.
Right.
And we have a lot of patients decline a transvaginal ultrasound as well. And so then we have to send them back, fill their bladders, and that delays patient care too. And so I feel like maybe nurses asking ultrasound, like, hey, do you guys need this patient to have a full bladder before we, get a urine sample? Because we can always have them give the urine, in the middle of the ultrasound between the two exams or
Right.
whatever. But I think that's just something that would be cool if there was understanding and communication between the two of us.
No, I think that's great. And it's a good point to bring up, because I think that, again, we're all members of the care team, right? And communication is probably one of the biggest aspects of the care that we need to
Yeah.
make sure that we're really a part of, making sure that, at the end of the day, there's a patient, right? So we all are trying to do best and well by the patient. But if we don't communicate, or if we have poor communication, and I mean, that nurse going to your supervisor, that's some shadiness.
Wasn't
Um,
nice.
yeah, not very nice at all. That
Yeah.
really, a lot of these problems can be worked out by just simply saying, "Hey, I need to do this beforehand," or "Can you do this with my patient?" and just really, opening those doors of communication and not be afraid that from one professional to another to have those conversations or just to ask questions to say, hey, does this need to be done or whatever the case may be, because we all have the same goal, and that goal is to make sure that we leave our patients better than what they came in. So I appreciate that feedback. I will take it back to my nurses and be like, we could do a little bit of a better job here and make sure that we're not calling supervisors.
Yeah,
It's
unless
just,
it's like really dangerous. Like, talk
yeah,
to
come
me.
on,
Yeah,
that's wild. Give
silly.
me that nurse's name.
That's where I'll
Let
send
me
it.
send her a nice email. Yeah, again, just you're right that we can do better in relation to communication, and I'll make
Yeah,
sure that that feedback kind of goes back out to my nursing community, that we could do a little
thank
bit of
you.
a better job.
Love
With
it.
that, is there anything else?
Nope, nope,
All
that's
right.
it.
Thank you so much, Jessie, for coming on the Green Nurse podcast to share your story and your knowledge about being a sonographer. I think that there is one thing you did mention: your job, your other job, your
Mm,
business. Could you tell us
yeah.
a little bit more about that and where people can find
Yeah.
you?
Yeah, thank you so much for asking.
Yeah.
I started a little 3D 4D in-home ultrasound business. It's called New Life Imaging, and it just came from the passion of scanning babies. And so I started it. I'm in Middle Tennessee, and I come to you. I come throughout like Clarksville to Nashville and everywhere in between. And yeah, it's been just so much fun. I have way too much fun. I go to baby events, and I do a lot of work for pregnancy loss. I work with a pregnancy loss team, and so if when we've heard that there has been one, they'll call me and I'll go and do a free scan in their home
Oh my goodness.
because they were here, they existed, and it is a passion of mine. And then yeah, I work a lot with the military and pregnancy centers, and yeah, so it's been just the greatest joy for me to be doing this little side business. So
Wow, you wear so
yeah,
many hats.
I
Where
try.
did all that information go at the top of the episode? I
I
mean,
know.
that's such amazing work that you do, and I think people really don't understand. And I can say that I can empathize and understand what it's like working with women who've had a loss. And I think it's such rewarding work. I think people don't truly understand that we're there for people on their best days. So when they get that news that they're pregnant or
Mm,
that they come in to deliver, but we're also there when they get the worst news.
yeah.
And that is really, I'd say, sometimes where the work really starts, right? Having those conversations, showing compassion in the moment.
Mhm.
And, like you said, you took it one step further to actually be actively supporting these women in your own time with another role. So thank you so much for the work that you do, Jessie. I'm going to send people, where can they find you online?
Yeah, so I have an Instagram and Facebook page. It's New Life Imaging LLC. And then I have a website, www.newlifeimagingus.com. And
All
that's
right.
where you can find me.
All right. Thank you so much, Jessie, for
Yeah,
coming on the Greeners podcast. Again,
thanks.
such a great conversation, and I'm looking forward to seeing what you continue to do. I'll be following you,
Yeah,
and maybe we'll have another conversation if there's another story that arises. So, thank
yeah,
you
I'd
again
love
for
to.
coming on.
Thanks so much for having me, Amie.
Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses: Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amie Archibald-Varley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much, and stay tuned until next time. Stay gritty.